This is Sarah Trott, and welcome back to the Fourth Trimester podcast. I'm here with my co-host, Esther Gallagher. Hi, Esther.
Hi, everybody.
And I'm so happy to welcome back Dr. Shoshana Bennett, who is a beloved returning guest and one of the pioneering voices in maternal mental health. She is a perinatal psychologist, an author, the former president of Postpartum Support International, and a trusted expert who's helped more than 20,000 parents around the world and counting. We are going to be looking at how the breastfeeding experience can affect emotional well-being in our conversation today. So welcome back, Dr. Shosh.
It's a pleasure. Thank you so much for having this particular show also, and including the mental health aspect of the world of breastfeeding.
Yeah,
Yes.
Thank you. Dr. Shosh, I'd love to give you a couple of moments to introduce yourself once again for anyone who is new to the show and new to you.
Certainly. I am here based on my own personal experience with postpartum depression, postpartum anxiety. I had been a special education teacher, but many, many years ago, after the birth of our first child, I dropped into a very serious mental health challenge. With a number of the perinatal mood and anxiety disorders, and it developed into what I do today. And it's a passion to educate and to be on shows like this, and especially this one where there's such an emphasis on genuine education, not just promoting, the lines, that's out there in social media, but you have such a passion for telling the truth and being real. And so I'm absolutely delighted to be here.
Thank you.
Thanks so much. Ringing endorsement. Wow.
I'm absolutely thrilled to be here again.
Well, we're so excited to dive into the breastfeeding topic. And just to kind of warm us up a little bit, when you picture someone who's breastfeeding with confidence, what does that actually look like and feel like in daily life?
Certainly there's a sense of competence when, especially if she has been working at it and wanting very, very much to have the experience. There can certainly be many, many, many challenges that we'll get into and how that can affect her well-being. But as long as she is choosing to breastfeed, and that's a goal of hers, and it's working well for the diet and for the family, that's really what I'm picturing. A happy, healthy mommy, a happy, healthy baby, and a happy, healthy relationship, because that's really where we need to focus, not so much on the mechanics of, a body part into mouth.
Yeah, that makes sense. And Esther, as a highly, highly experienced birth and postpartum doula, how often does breastfeeding come up from a mental health perspective?
Well, because I try to be working with families in the first 2 weeks, it almost always comes up in terms of mental health. Many parents will experience being really very tired and therefore like, I don't know if I can keep doing this, right? So even just that moment or many, many, many moments, I imagine in the world, if there's not somebody to reinforce, reassure, nourish, etc., at least in my worldview, right? Those critical moments, day 3, day 5, day 7, can go south. Even with mothers who had every intention and were sure that they would breastfeed. And that's if they haven't encountered other real problems yet. Perhaps low milk supply, a baby with a tremendous amount of jaundice, back and forthing to the hospital, traumatic birth. Like there's a whole lineup of experience that can and will have some level of impact on a new mom as she's also then navigating healing, recovering, and keeping her baby alive and fed. So I think we all get pushed right up against something in the first weeks postpartum in this culture, almost always.
it's wonderful what you just added, Esther. The problems, of course, come when mom gets lost in the picture, because often even very well-meaning professionals and those around the new mom, encouragement can sometimes feel like pressure. And also with the sensitivity, the extra sensitivity that new moms often have, what they're hearing with the encouragement. And that's why we have to all be really careful about that. Yes, we know she wants to breastfeed, but it's also important when we say keep going, or modify this, do this, you can do it. She often feels it as pressure to continue. Sometimes she wants to, sometimes she doesn't. And that really needs to be explored, honored, and respected. The problem is, and again, you are not one of the professionals I'm about to mention whatsoever. You're fabulous. But there are professionals, very well-meaning professionals, who tend to be quite rigid. There's a way to do this and follow this plan no matter what. Keep going. They mean well. I'm not throwing folks under the bus here. They're coming from a good place, but often they're not checking in with what's best for mom, what's best for the diet, what's best for the family, because there are so many factors involved. But there was an extreme example a few years ago that I'm thinking of, and I've got her permission to mention her name. When she contacted me, her name still is Diana. I shouldn't say when she contacted me. I'm sure it still is. When Diana contacted me, she was literally, I was Zooming with her. She asked if I could see her. She was literally in a fetal position. And when I say exhaustion, I mean clinical exhaustion. She could barely lift her head. It was more than just, she was 2 weeks postpartum, by the way, more than just very, very tired. She was malnourished. I mean, it was shocking. I didn't know what she looked like before, but it was really what she kept saying was, I'm not throwing any group of people under the bus here, believe me, but what she said in her story, her lactation consultant told her every 2 hours she must set her alarm and feed the baby. There were no medical problems with the baby, but she got lost. She got lost. No one checked in with her to find out are you eating? Are you right? Are you getting enough water? Are you taking care of yourself? So I got her husband on the phone immediately on that Zoom call and said, get a bottle of formula now. She didn't have insomnia, thank goodness. So she could get a few hours straight of uninterrupted sleep at nighttime, get some protein, get at least something, some nutrition she could drink, right? Pizza. She started to drink some protein shakes because she had no appetite. She was depressed as anything. Get some fluids in her, some electrolytes in her. And I swear by 2.5 days later, she was up, feeling much more like herself, not 100%. She still had a way to go. She was starting to make milk again. I mean, her milk production, it became this horrible cycle, right? Because she got lost in the shuffle and no one was paying attention to her needs. She didn't think her needs should matter. It was breast is best and you gotta. And again, it's an extreme case, but I've been doing this work for a good 4 decades. And I can tell you hundreds of women have contacted me depressed as anything, saying, do I have to suffer psychologically and physically in order to be a good mother? And of course we know the answer is no.
I mean, 48 years later, I remember just realizing, it was a realization. Oh, I don't exist in this. It's me and the baby. And if she doesn't exist for me, she doesn't exist either. And so, there's no expectation that anyone around me is going to feed me, water me, make sure that my sleep is undisrupted in the few moments when I get it, and it's a devastating feeling. It's just a devastating feeling to be in that, like, yeah, now it's over. Like, I'm over. I'm just the vessel. I'm just gonna keep this baby alive.
Mm,
And, that just made me mad. So I mean, not just, but there was enough
sure.
in me at that point where I was just like, well, then fuck y'all. I'll take care of myself the best I can. And that's not the way, that's not good mental health. That's
Exactly.
just,
That's what should not
just
happen.
fury.
Right.
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 Yeah, exactly. So, and it's what I had, so it's
Mhm. Mhm.
what I did.
Mhm.
It's not to say that there weren't people. I'm thinking of one person in particular who didn't care about me, but they also had a new baby and were subsumed under that. And so even when we feel like we may have cultivated some kind of support in the world, it's not always available, right? We have to have a multi-layered kind of resource,
Mhm.
which includes our mental health, our emotional health.
Absolutely. And, the way one chooses to feed one's baby should also not be a test of whether you're a good mother or not. I mean, they're all, the breast is best. I'd love to change that to what we said at the beginning. I mean,
Yeah.
look, we know the benefits of breast milk and that's all, we're very much aware of those. But what's really best for the baby is a healthy, happy mommy. That's what's best. And a healthy, happy baby and a healthy, happy relationship. I mean, that's what we need to be focusing on. So when moms equate their value and worth as a mom with how they are feeding, that's a problem. And that should not be so. I mean, moms, if they can't breastfeed or if they've tried and various physiological reasons, medication, all kinds of things can come up. Maybe they need to modify. Maybe they can't breastfeed at all. It sets them immediately on a path of, I deprived my child. And the guilt gets in the way of so much. It causes so many problems, including depression and
Well, I
anxiety.
think
Who wants to?
paralysis, right? Behavioral paralysis. Like everywhere I
Absolutely.
turn, I'm doing the wrong thing instead of, oh, if I just lean towards that over there, it will all work. It'll work out. We'll be okay.
Right.
Yeah.
That's
Yeah.
right. So
Yeah.
doing what works in the family. There is no one size fits all. And, I've often helped moms who really wanted to continue breastfeeding. I've helped them by making sure that they don't get lost in the shuffle, right? And they do get some nurturing themselves and they don't feel like they don't exist anymore and that, it's all, and they're able to continue. By the way, side note, I would love to throw out the word success when we put it together with breastfeeding, because what's the opposite of that?
Mm. Yeah.
Failure. So
Yeah.
when we say successful
Yeah.
breastfeeding and there are problems, moms are thinking, I failed at this. I must have failed at being a good mother. I mean, it's so emotionally loaded. We have to be very, very careful. And some of it is really subtle. But again, if she's choosing to breastfeed, I am all for helping to support her so that she can help that happen as much as humanly possible and not to feel bad if for some reason it doesn't work out or there's so many different plans, right? It's not all or nothing. It's not either
Yeah.
breastfeed around the clock or, total bottle feeding there's so many different ways to help it work for the family. And that's what she should feel good about, helping to come up with a plan that baby is supported, she's supported, so she's got what it takes, to be the mom she wants to be, be the wife she wants to be the person she wants to be. That's, to me, that's success.
Well, I'm just going to circle back to fundamentals as I so often do. And one of the ways, a very, very, very simple way that you can help a mom not feel like she doesn't exist is to feed her when that baby's eating, however the baby's eating.
Mm-hmm. Mm-hmm.
If it's at the breast, then all the more reason why mom needs someone to actually put the food in her mouth because she's got her hands full. And if she's going to sleep, she can't be eating when the baby's sleeping, right? So I say it on every single episode, feed the mom.
Mm-hmm.
That I know in my world, that makes me feel seen. If somebody will nourish me even a little bit when I'm unable to do so for myself
Mm-hmm.
in a way that's appropriate to what's happening. And with breastfeeding and baby feeding, which is around the clock, it's whenever that baby's eating. It doesn't have to be a turkey dinner. It needs to be some protein, some fat, and some veggies.
It's feeding to me. It's feeding on all levels. It's nurturing in every single department, asking her, how can I support you? Because
and you can do that when you're poking food in her mouth. What can I rub your feet after this? Do we need a doula? Yeah, let's get a doula. Do we? I can think of a million, discussions, but not while she should be sleeping. Don't have those discussions if she can be sleeping. Have them while you're eating. Eat together. Enjoy it.
Yeah. And Dr. Shosh, your story about the woman who was really kind of at her wit's end, what was right for her in that example? Did she end up doing a mix of breastfeeding and bottle feeding? And
yes, she did. The husband continued, in her particular case, the husband continued to do 1 bottle per night, which gave her 5 hours of uninterrupted nighttime sleep, the brain restorative sleep. She started to feel more like herself. And she also, as we worked together, she also had time for herself away from the house. We built in all the other things, you and I have talked about in other podcasts about how you really make sure you don't get lost on any level. Right. And yeah, that absolutely worked for her. The depression lifted. In her case, she did not need other, types of, depression help from a professional. In her case, that was what was happening. She was so depleted and so depressed because of what was happening with the rigidity, the adherence to this very rigid breastfeeding schedule, that when we turned it around, she thrived. And she and her baby did fantastically well. And yeah, that was a wonderful success story, not just about what happened with breastfeeding, but what happened with the family.
Mm-hmm. Mm-hmm. Yeah, that's very sweet. And I think it's worth mentioning that this word depleted, it's no joke. And I see it all the time. And I'm seeing it in part because women are getting to the end of their obstetrical care only pregnancies, anemic, undernourished, things that could have been looked for and thoroughly addressed were not during pregnancy. So they're already behind the gun when they give birth. And some of those physiological issues can lead to things like, or undercut things like hemorrhaging, right? If you're anemic, you're more prone to hemorrhaging. That's a terrible thing, and it's low hanging fruit. No woman, not no, but most women in this world do not have to end their pregnancies anemic and then more anemic as a result of birth trauma. So if we as a culture are going to highlight and promote breastfeeding, then we really need to back it up into pregnancy with better education, with better nourishment and understanding of the physiology of pregnancy and birth that leads into breastfeeding, because it's a continuum. It's all happening along the way. Yeah, I just want to put those 2 cents in there.
Absolutely, because then she's launched into new motherhood already depleted. No doubt. But again, there should be a choice. She should be asked, do you want to breastfeed?
Yes.
And again, as I'm sure we all agree, there can be subtle and sometimes not so subtle raised eyebrows, the guilt trips, of, what kind of a mother are you is implied, right? Or if she chooses to, I work with women who have had previous mental health challenges. They're having another baby. They know how high risk they are, for instance. So they'll say, there's going to be a bottle. My husband is going to give a bottle that right from the get-go at nighttime. I will breastfeed the rest of the time, or I'll pump. I want the baby to get some of my milk, but I have got to sleep because sleep deprivation was the biggest factor in their challenges mental health wise the first time around. That is what works for them. Bravo.
They came up with a wonderful plan.
Exactly right. Exactly right. But they had to work on kind of filtering out all of those messages. The public announcement, the media will do it. Social media definitely, and all these. It's often very unrealistic for many moms. And again, we want to launch them into motherhood feeling really good about what they're choosing, not like they deprived their kid. I often hear, oh, but I breastfed my first child for this many months. I have to do it the same way for my next one, or else that one's getting ripped off. And I'm going, wait. Your family looks different. Your first kid is now a toddler that really needs mommy. And you know what I mean? So I will help them see it's not the same situation. If it works out, you can, breastfeed around the clock and it works for the family and you're not depleted and you're doing well and you're thriving. Great. But if not, let's modify a little bit so that it works for your whole family unit.
Yeah. It's so interesting. You talk about the messaging and the pressure it can put on someone to think that they have to breastfeed or else. But, my grandmother who was having babies in the 1950s told me her story about, as soon as she had her babies in the hospital, they said, here's your dry up medication, right? They were actively pressuring and just instructing women not to breastfeed and medicating them in that way, which is the polar opposite. So my hope is that we get to a place, some kind of middle ground, kind of as you're talking about.
That's why we're doing this podcast, right?
Yeah.
It's choice.
Yeah, it is choice. It is choice. So maybe we'll talk about feeding success instead of breastfeeding success, right?
There you go.
Yeah.
And now on that note, because of what I do, working with depression, anxiety, et cetera, with moms, those women, I'll just want to mention a quick little mention to those women who might be listening, who cannot. They really want to breastfeed and they can't for various physiological reasons, medication reasons, other reasons. That's a whole other thing. We also don't want to dismiss their possible grief about not being able to experience that, right? By saying, well, at least your baby's fed. You know what I mean? Which is true. I mean, a good mom makes sure her baby's fed, period. But she also might have some other psychological things that need to be processed.
Yeah, for sure. And on that note, kind of circling back to something you said earlier, Esther, I wanted to talk to you both a little bit about the mental health preparation aspects that someone can do early, perhaps during pregnancy, to support their feeding success. So I think we touched on maybe setting realistic expectations. In other episodes, we've talked a lot about reviewing mental health history, right? For, feeding, but just in general for your postpartum experience.
Yes.
And I want to just poke in there and Dr. Shosh, you let me know if this is appropriate. Maybe also if they know anything about the mental health of their own mothers and grandmothers, it's plausible at least that the physiology of postpartum can run in the family, right?
Yeah. No, absolutely. when I'm training doulas, midwives, et cetera, I will encourage them to have just in their intake sheet, to try to gather the information. It's not only moms and grandmas, it's any blood relative who has had any mental health challenge. So, it does make them a higher risk. But again, no matter what, it doesn't mean that they're going to have a problem. But again, what we need, the general message to everyone, first of all, it's great when we know if we're high risk, right? Then we can really have our eye on coming up with a plan ahead of time that can truly, truly support. But we always want to support, no matter what the mental health history of the family, obviously, and the preparation. Some of the things we've already talked about today is making sure that the mom, just like the birth plan, they think is in stone. I'll call it a wish list.
Yes.
If everything's going well and rolling around the way you want, the way it's great, it'll work out this way. But don't get so attached to any outcome that it will completely derail you and devastate you if it happens not to go that way, whether it's the birth itself, labor and delivery, whether it's breastfeeding, right? So it's really helping with the mentality of however it unfolds, you will be fine.
Flexibility.
It's about that mentality can make the difference between depression and no depression, anxiety and no anxiety. It's huge. I wish somebody had taught me this before I went through what I went through. It's rolling with it, and no matter what, you'll have the resources to help you.
Yeah.
Yeah.
And speaking of resources and planning, right? Like thinking about what professional help you might want to surround yourself with.
Absolutely.
Yeah. Proactively, right?
Absolutely.
Not just like, oh gosh, yeah, I guess if I have a problem, I'll just noodle around and find X. Well, particularly if you know yourself to be prone to any kind of mental, emotional challenge when things get heavy, as they do, then, knowing that you already have a connection with the person who's going to be able to.
It can give one tremendous peace of mind. Absolutely. And even if they're not, if their budget allows, right? Whether or not they're high risk. Doulas cut postpartum depression in half. A wonderful doula. We know the benefits of doulas. They're amazing and truly supporting the emotional well-being of the mother as well. It's not only about mechanics. It's about, doing what she needs.
And along those lines, people start to get concerned that, oh, well, I just don't have the budget for that. But if you're a Medi-Cal mom, you get to have birth and postpartum doula care through Medi-Cal for pregnancy and postpartum. So you do not have to go without.
And we know there are similar systems in other states and around the world as well.
That's right. But also, if you don't even have access, or for whatever reason you don't want another person in whatever, often you can have a friend in there a few times a week, or you can import a relative to live with you, as long as they're the right relative, to give you the true support that you need, no pressure, no, guilt tripping, of course not, no judgment, but just there for you. So you might just know that person, might not even be a hired professional, but just someone who is there to watch out for you and support you in the ways that you truly need.
So what would you tell a couple who's expecting a baby and they're saying, like, what should my plan be?
My goodness. What I do when somebody contacts me, I find out what their specific, what the factors are surrounding that particular unit. And because I will individualize for that particular family. The first thing I'll do is commend them that they have that wonderful roll with it attitude that we were talking about a few minutes ago. Is that's how you introduce that question. If they're ready to do whatever, I'll say that is you're already on the right track. You guys are going to be fine. if that's the way you're thinking. And then I would give them specifics. If she's very sensitive to sleep deprivation, I might suggest, either she pumps or there's a bottle of formula at night, pretty much what Diana did, just to prevent the sleep deprivation, which can take us downhill very, very quickly for some women. I would make sure that she's got support mental health wise, not necessarily professional, but who does she have to lean on? Does she have a mentor person who she can just, I'm having a tough day. Can I just unload? One of those people who will not be judgmental at all and who will give her a big hug, whether virtual or physical. Who's going to bring you food? Who's going to bring both of them food? It's not, look, the father becomes the partner becomes a new parent also. So they shouldn't just be used as the support. They also need their own support, and they shouldn't be forgotten. Obviously, it's not their body parts involved in breastfeeding, but they still might have concerns and needs that need to be watched out for. So again, full plan of action I help them with. And this happens all the time. I love it when pregnant couples call me. They contact me and say, what can we set up in advance? And this most frequently happens when they know they're high risk, when the mom knows they're high risk, right? And that's what chapters in my books are all about, prevention. And that's what I talk. I'm all about prevention, just like we all are here on this podcast. But I will help them with the mental health plan, the physical health, nutrition, exercise, and modify as they go along if it needs it. And it doesn't have to be complicated.
Yeah. And perhaps a consult during pregnancy, or set up a consult for shortly after birth, maybe at the, I don't know, Esther, you tell me, 1 or 2 week mark, something like that, with a lactation consultant.
Well, most people in this system here in the Bay Area will have seen a lactation consultant at least once in the hospital already, because so much is about to happen right at the juncture when they're discharged from a hospital setting on day 2 or 3, right? That's when stuff starts to get real, where breastfeeding is concerned in most cases. And so if they don't already have a load of fear, they're often given one on their way out of the hospital, because it's all about weight gain, right? Or weight loss, as it were. And so a lot of parents are going home really nervous, but also really tired, really distracted, having heard from many different people, different opinions about what they're supposed to do when they then are home alone, right? Like, feed every X number of hours, but without any real guidance beyond that, right? Because just because it's 3:00 doesn't mean your baby's going to cooperate in any way, right? And it also doesn't mean that they don't actually need to be fed as well. So there's a lot going on, just as parents are trying to, they hope, right, have some normalcy after, if it's the first baby, a long labor, who knows what kind of delivery, and then 2 days in the hospital. So then they land at home and they're just like, oh, oof, thank goodness. And then it hits, right? So understanding that transition, just knowing that that's how it looks for most of us if we've had a hospital delivery, will help people, because you can then strategize, like, okay, you're going to get home, you're going to get in bed, you're going to eat together, you're going to rest if it's not time to feed the baby. Right?
Well, hold on there just for a sec, though, because, is it worth acknowledging that if someone just takes a rule like that and sets it in stone, like it's some hard and fast thing, you're ignoring your own instincts and what the baby, like the communication from the baby is, right? Like, are they even hungry? Yeah. Are they even giving you any cues? And
do people even know what a feeding cue looks like after 2 days or 3 days in the hospital? Is a fundamental question right there. So good for you, Sarah. Absolutely right.
Right.
And so if there's nobody around to say, oh yeah, baby's having a feeding cue right now, would you like to try a breastfeed, right? Would you like to, how are you feeling? How do we?
No,
I'm noticing your baby is actually hungry right now. Like, where you at? I can
in
help you
real
with
time, pointing it out.
in
Yeah,
real time.
absolutely.
Yeah.
But the
Yeah.
unrealistic expectations are huge. Often, as they're leaving the hospital or the clinic or the birthing center, wherever they are. And I'm glad you mentioned fear, because that is often so heightened, the anxiety. And here the hormones are doing their thing too. I mean, the
Oh, yeah.
adjustment is tough enough, but wham! I mean, your estrogen's going down to nothing. You're
Yeah.
sweating profusely and your moods are all over the place. There's so much
Your
happening.
breast
Just as
may
you
be
said.
engorged, and that's painful.
Yeah.
You may have vaginal vulva tears, and that's painful. You may be having serious, afterbirth cramps and bleeding that you don't understand. It's overwhelming for the best of us if we haven't really got anyone around to be checking in with.
That's
So,
right.
yeah,
And
there is a
sometimes
lot going on day 3, 4, and 5, and 6
and
and 7.
and sometimes women would have liked to continue breastfeeding, but because of all this stuff and the lack of support, they say, forget it. I can't handle this. This isn't for me. So that happens also. Sometimes I'll help to, it hasn't been that long. We'll help to, turn it around if she really wants to, relaxate and get that going again. But yes, it can be absolutely overwhelming. And sometimes they'll throw their hands up in the air. That scenario happens also. And that's sad, because then she regrets not having known everything she knows now. And, she didn't have the experience that she was hoping to have.
Yeah. Yeah. So I want to ask you, what does the relationship between breastfeeding and maternal mental health really look like?
It depends. I mean, if one doesn't need to breastfeed in order to bond, I will say that first of all. That's also another myth that is out there, that scares women. So bonding will happen. That happens over time. It's not an instantaneous kind of a thing anyway. But it can look very different. In answer to your question, it's very varied. What happens with mental health and breastfeeding? Sometimes it is a fabulous experience. The mom feels close. It's an intimate, terrific. Yeah, we hear all about that. The wonderfulness. Sometimes with the letdown of the milk, there is a particular condition that sends her into a panic attack and makes her horribly depressed, which often isn't talked about, but that can happen also with the letdown.
It's referred to as dysphoria.
Well, dysphoria, yes, but it has an acronym, and frankly, it left my mind. It actually is about the letdown of dysphoria is like a low level, or dysthymia, dysphoria. Yes,
Dysthymia, yeah.
but it has that's low level depression. But I'm talking about something quite serious. We don't have to go in that direction right now.
Yeah,
but
yeah.
mental health is awful, because they're thinking, what is wrong with me? Am I that messed up that I get depressed? All these other moms are, they're in euphoric land, and I'm feeling awful when I feed my baby. So is the connection good there? Also, if they're in horrible pain, if they're not getting proper support, if their nipples are splitting and bleeding, I mean, when you're in that much pain, there's not going to be a whole heck of a lot of bonding happening. The baby's bonding, but the mom is having a very hard time connecting, and sometimes, frankly, holding a baby with a bottle so their nipples can heal a little bit. They get better eye contact. That's when some real bonding can happen, until she can go back to breastfeeding, if that's her choice. There's so many different factors involved that affect that relationship, but that's what we want to look at. Happy, healthy mommy, happy, healthy baby, no matter how they're being fed, right? And that relationship, that dyad working beautifully together. That's the goal, much more so than the method of feeding.
Yeah, that's really helpful. And then the second part to that is really, if someone's having feeding distress in some manner, what are some signs that it might be going beyond will be considered just like a low level stress and goes into something a little more complicated that probably does need some professional attention?
Well, here's one example. If she is obsessing about weight gain and weighing and weighing and weighing that baby. I mean, I work with women who, when they first contact me, they've gotten a baby scale. I mean, it is a compulsive kind of a thing. She's measuring ounces all the time, which is very hard to do. How do you measure ounces when you're breastfeeding? You know what I mean?
Yeah.
So she might start pumping so she can see exactly how much is getting into the baby's mouth. You know, that level of obsessing is definitely a sign that she needs some mental health support. Sometimes it's a matter of simply reassuring her, but also you can reassure, yes, baby is gaining, but then the obsession goes to something else and it's one thing after another. That's when she most likely needs some therapy. She might have some OCD going on, obsessive compulsive disorder.
And she might need a pediatrician who's focused on more than just whether or not her baby's gaining weight and whether or not her baby has an issue that all the volume in the world is not solving. So, I've also seen that, like the mom is making plenty of milk. She's getting it into the baby and the pediatrician keeps telling her, well, you're not feeding him enough. Well, what if it's the baby?
Right. There's a tongue
Could
tie
be the
or something.
baby. She might not be wrong.
Yeah.
That there's actually
No, that's very
something.
true. That's a great
and I know
point.
you didn't say she was wrong. I'm saying, right, that she wasn't getting enough support to really get to the bottom of why her baby's in X percentile and whether or not it's okay. And instead, she's been loaded up with a feeding problem. And now, and now, of course, she is obsessing over it.
Yes.
So I do think, like, yes to mental health support, absolutely. But in the meantime, as I imagine you would, like, well, you might need a pediatrician who will get to the bottom of why your baby's not gaining weight if you're pumping them with everything you got and you got a lot, right?
Sometimes we think it's her anxiety and she's going, no, there really is a problem here. Would you please listen to me? And it's not I was talking about more of the, when baby's fine.
Yeah, absolutely.
But sometimes baby is not fine. You're absolutely right. And no one's believing her. That's a whole other issue that can be more than frustrating. Yeah. So,
and, and I will put myself in this category. Like a lot of times when a mom's showing up like that to say a support group, a breastfeeding support group or something, it's like, well, the baby also seems fine. He's in a tiny, he's tiny. He's in the percentile, blah, blah, blah. Is the baby fine? If the baby's fine and the mom's fine, I think to your point, Dr. Shosh, how do we get mom to really feel that she's done a great job, right? That everything's fine and have a different experience than always quantity, quantity, quantity. And maybe now some quality.
mm-hmm.
And it's hard. It's hard to watch moms who are just like nobody's given them anything but numbers,
Exactly. And asking her, how do you feel about being a mom? I mean, you might hear some pretty interesting things. Everyone assumes, if baby's healthy, she's fine. She really might not be. So it might look fine from the outside. We've done podcasts together about postpartum depression. You can't count on telling she's okay by looking at her. She might have her makeup on and breastfeeding's going great, but she might have all kinds of things in her mind, like I'm not giving this baby what I should. I didn't do what I did with the first one. I'm falling short. You don't know until you really ask. So I do encourage support people and professionals around her. Don't assume anything. Ask her, how are you doing? How are you feeling about, it looks like breastfeeding is going well. The feeding is going great. How do you feel about it? You might hear something that you were not expecting at all.
Yeah. I think that can be a place where it's wonderful to be in a feeding support group, no matter how your feeding journey has gone so far. And if you're reasonably lucky, I mean, I think it's pretty true these days, it'll be a nice group of several people who've had very different experiences and care about how they feel and care about how you feel. And so often, moms are the front line of like, yeah, I came here because I'm not really getting a lot of good feedback when I say I'm not feeling this the way I think I should, or want
Yes.
to be able to, or whatever. And at least someone in the group will say, I hear you.
Now, the
I
leader,
see you. I hear
right.
you. Yeah.
That's great when somebody's brave enough to say something like that. But the leader of that group, whoever is running that support group, they can make or break it because they set the tone for what's safe to come out and say, right?
Yeah.
So often it is very much, I know there are many lactation support groups that are just about mechanics. And feelings of the moms are really not discussed. So you can't assume that will happen. So we can encourage moms to ask, and to be those brave ones. But really, the support group leaders need to know to elicit that kind of feedback. To bring it up. Don't wait.
I was sitting in just a new parent support group. It wasn't focused on breastfeeding, but everybody was feeding a baby, they were there feeding babies. So that was part of what people would talk about. And I thought this was really sweet. And the facilitator said, let's see if we can identify a feeling and a need. And I thought, it's a little bit of homework, but it's, here we are in the room, and maybe not everybody's kind of geared up to sort of perform that thing, but it invites them maybe for the first time to identify some feelings and maybe attach them to a need.
You said something really interesting, though, when you were setting up the scenario. You said everybody, of course, was breastfeeding. Guess who didn't?
Was feeding a baby.
Oh, feeding. Okay, because I'm thinking, guess who didn't show up to the group?
Yeah, no, everyone was feeding a baby. Yeah.
Okay.
And not all of them with a breast. Yeah.
No, okay, good. I assumed something incorrectly.
Yeah.
That happens. But we need to be sensitive to that. Yeah.
Oh, yeah.
Because a lot of the mommies I work with that are doing partial breastfeeding, partial bottle feeding, it might be some pumped breast milk, it might be formula. They often don't want to show up to the support groups is my point. Because they don't want the guilt trips. They don't want the looks. They don't want the raised eyebrows. Like, what's wrong with you? Because again, what is around society way too much is a good mom is a breastfeeding mother.
Yeah.
Why would they show up to a so-called support group that is not supportive?
Right. Yeah. Well, and we can even back into one branch of all of that, which is, a lot of us did not make it through our teens and 20s without some serious body dysphoria. So, add that into the mix, and showing up in public to do a thing that we may feel, reasonably competent to do at home is a deal breaker, right?
Right.
It's just a deal breaker.
That's right. And I work with a lot of cancer survivors. I'll call them. I am one as well. I've got one breast. If that had happened when I was younger, around that time, right? Who knows if I would have shown up to that group.
Yeah.
Do you know what I mean? So, the women I'm working with are in childbearing years. So we never know what somebody's situation is. And I think the whole theme of this wonderful podcast that you've allowed us to do is about support and finding whatever ways work within that unit, supporting her, supporting the family in whatever ways, and helping her feel good about whatever plan, right? They need to come up with regarding the way or ways that baby is being nurtured, is being fed. Yeah.
Yeah. And that's so confidence building, right? Like what you just said, like finding what's right for that family. That's what creates confidence in breastfeeding.
That Absolutely.
Or
And for the
confidence in
woman,
feeding, period.
there you go.
Yeah.
Skin to skin, you can do that with a
Yep.
bottle. Well,
Yep.
who made that rule that skin to
Yeah.
skin only has to be breast? And
No.
again, with bottles, skin to skin, you can get much better eye contact than a face squished up into your breast.
Yeah.
There
Yes.
are some pluses there too. Who knows? But no,
Yeah.
absolutely. I'm so glad you said that. And again, no matter how that baby is fed, the mom, the family, she needs to feel wonderful. Look, what babies need is a responsive caretaker, someone who is going to feed him or her, somebody who is taking care of all of their needs, right? Emotionally, physically. And that's what's important here, not the method of feeding. So no, I love it. Skin to skin can happen in any way.
And skin to skin is one of the primary ways we can affect depression.
It does help. Yeah, that's
Yeah.
what massage, those baby massage classes and all really wonderful.
Well, and
for
I
bonding.
remember there's this wonderful program I just was addicted to. I loved it so much, To the Best of Our Knowledge. And they did a whole deep dive into depression over a handful of weeks even. And there was a wonderful woman talking about her very, very scientific, deep dive into depression. And she said, what's so interesting about all this science is what it comes down to is moving the skin. And she just touched her arm and she just did this. And I'm somebody who's single and I have a roommate, but I essentially have lived alone for a long time. And when I heard that, I was like, oh, so when I get in my shower every day, I'm going to make it count. I'm going to move every inch of skin I can get.
No, that's
and
great.
it's not just to get some soap on and rinse it off. It's going to be like, I am going to touch
a nurturing
myself
kind
head
of touch.
to toe. I'm going to get out of the shower. I'm going to lotion myself from head to toe.
That's great.
And I think that this has really helped me a lot.
That's wonderful.
But we all need it, right? We all need some contact. So.
Touch. Absolutely.
Yeah.
I do want to mention something about breastfeeding and depression, if I may.
Mm-hmm. Yeah.
Often there is a fallacy that might surprise many folks, because often, again, very well-meaning professionals and others will say things to new mothers like, or to mothers to be, breastfeeding will help to prevent postpartum depression. I want to tell you that research says otherwise. Now, let me explain. It doesn't necessarily, okay. What happens is that, yes, there are more non-breastfeeding mothers who are depressed, but the depression preceded the weaning.
Mm-hmm.
It is because she was so depressed, because she was so depleted, and probably not getting the support that she truly needed so that she wouldn't get lost in the shuffle, right? Like the Diana story, she didn't get the sleep, she didn't get the nutrition, she didn't. And then she said, I can't do it. I'm going to die. I can only take care of one of us. I've got to stop breastfeeding. So it tends not to protect. It's not that it protects because I get calls, my gosh, hundreds upon hundreds of women throughout the 4 decades I've been doing this saying, I'm so mad. They told me that if I breastfeed, I won't get depressed, and I'm depressed. And so I tell them, no. Yeah. It can be wonderful. Yes, there can be the prolactin. Yes, there can be, but no, you can be depressed as heck and still be breastfeeding. So I just wanted folks to know, again, I'm not saying don't breast. I mean, breastfeeding is fabulous if you want to do it and it's working, all that great stuff. But if you're counting on, right? If I'm breastfeeding, I won't have to worry about that postpartum depression stuff or any mental health challenges. That would be a mistake.
That's a setup.
Exactly. We all need a wonderful plan of action, no matter how we're planning on feeding. So I did want to make sure that your viewers do know. Yeah. And there's always a way to help. That's the other thing. We don't want anybody leaving this podcast going, oh no, so there's always nothing to worry about. It's all about getting informed so you can have a wonderful plan, not setting yourself up for you have to do it this way, right? For anything, for feeding, for sleeping, for,
Yeah.
For the birth.
for the
Yeah.
birth. Absolutely. So no setups. Be ready to roll with it, but there's always help out there. And as long as you know resources are there, hopefully that gives you all peace of mind, viewers, that nothing to be worried about. It's just, if you're running into some challenges, reach out and get the appropriate help for that particular issue, and you'll go on with your happy life.
And I'd like to invite listeners who aren't necessarily female or the birthing person to, it's okay to keep one eye out on these sorts of things. And if you notice mood struggles, that not only is it kind to, in a non-judgmental way, again, ask, how are you feeling? How are you doing? Would it be helpful if I sought some mood support for you, right? By way of talking to a professional who might be able to see you. Because getting on the phone sometimes is the hardest thing when you're depressed, right?
You bet.
Finding the person. I mean, of course, everyone will say, well, just go online. There's, and that would have stopped me right there. I'm telling you, like that does stop me, and that's just sometimes if I want a recipe, not necessarily mental health support, right?
Not only can online be overwhelming if somebody is having challenges, but you never know what you're going to see. So online. So it's better you go directly to a trusted source. Don't start scrolling.
Yeah, you can get in touch with Postpartum Support International. They have a great directory. You can ask your doctors, any kind of doctor that you have. You can ask your doula. If you don't have a doula, you can call a doula agency, even if they're not close to you, and say, hey, this is where I am. What do you have resources? Because doula, I've learned this from you, right? Like doulas are great resources who just kind of know everybody in the area and can point you in the right direction. So those are just some practical examples. And Dr. Shosh, is there anything else you want to share with listeners about the topic of breastfeeding and mental health?
If this is your choice to breastfeed, get the support that you need, see how it goes. But remember, breastfeeding doesn't equal motherhood. Motherhood is a relationship. Breastfeeding is a method of feeding. So don't confuse the two. If they work together and they work well, great. But don't have your worth, your identity completely tied with this particular method of feeding, because you're a wonderful mother, no matter how you are feeding your child. And it's very important you know that.
Thank you.
Dr. Shosh, where can people go to find out more about you?
Very easily to drshosh.com, drshOSH.com. I offer little classes there, and you can contact me for mentoring, for working one-on-one. I can let you, and also I do have a tremendous number of resources as well. If you let me know where you are, if you wanted to see somebody in person, I can often direct you there as well. But my website is the place to go. Very easy to reach me.
Wonderful. Thank you so much.
Thank you.
My pleasure. Thank you again.